So I'm just going to move on now to our next speaker, who is James Russell from the UK, and we're very grateful for James to join us here tonight. James is a 2002 Royal Veterinary College graduate and a postgraduate diploma holder in production animal and livestock medicine. He has over 17 years experience working in mixed practice, and he's been associated with the British Veterinary Association since 2008, and he's now their Senior Vice President. James is going to talk about how agriculture is leading the way with action on AMR in the UK. So we look forward to very much hearing from James and what's going on in our near neighbours. Thank you, James.
Fantastic, thank you. And before I begin, can I just clarify that I've shown the right screen?
Yes, we can see you. That's the right screen, James.
Perfect, thank you. And thank you for asking me to present here this evening. This has been absolutely fascinating for a vet to sit and listen to those two medical presentations. And I think this is something that, we are really closely involved with as a profession. And indeed, I've used a very similar presentation to this recently when I was talking about antimicrobial resistance and why vets matter. And I hope that that's the side of this story that I can bring to us this evening. So thank you for that introduction. As been said, I have a history of working in clinical practice, which I left to pursue an interest in infectious disease in farm species, principally TB, which certainly in my species we don't treat with anything at all, never mind antibiotics. But nevertheless, this is something that remains very close to my heart. And what I hope to be able to walk us through this evening are these sort of bits of this story. So I do want to show where we've made some progress, because I think we've got a really good story to tell in the UK. And I know we want to think about that in a more sort of international context tonight. So I hope I'm able to give that. I'd also like to highlight that we're not just looking at this from our production animal side, we are looking at this with our companion animals as well. And to recognise that we're not resting on our laurels in any sense at all. We recognise that having made some great steps, we've still got an awful lot to do. And I've already said, I think vets are going to be really relevant in this story when it comes to improving human health ultimately. And I hope it might be worthwhile for me to just begin us on this journey by looking at where we came from, what our thought processes have been. And really, we picked up this government report in it came out in 2019, and it looked at data through to 2017. And we worked with colleagues right across the medical sectors across the UK to develop this One Health in Action report, which really started to tease apart some of the challenges in the whole sector of what did it mean to be stewards of antibiotics, but also of health, of animal and human and environmental health in the 21st century. And this report is available online, but I'd just like to grab, one screen grab from it and say, I realise that we've got a very well-educated audience tonight, but we've tried to break this down in a way that we hope is accessible to anybody who wants to come and look at it, particularly in our case, our animal keepers. So we do break this down to look at this triumvirate and think about how those things are all interrelated. And I think that, this model holds up wherever in the world we go and apply it. We recognise that in order to have healthy humans, we need healthy animals and healthy environments, and we can follow that all the way around. And, it was almost like we had a bit of foresight, wasn't it? Because we released this in the back end of 2019, and then all of a sudden, One Health and zoonoses were the talk of the town, really, weren't they? As we entered into the 2 years that we have experienced under COVID. But whilst COVID is the sort of spotlight disease for this at the moment, we know, and part of our feelings of responsibility within this are that 60% of new human diseases are thought to be of a zoonotic origin, of animal origin. And I hope that that's where we bring our stewardship, not just of antibiotics, but of disease control to this story. So I'm going to delve in slightly to that report that came out in 2019, and I've realised that some of this is now quite historic because the data in that, as I've already said, only runs up to 2017. I have got some more up-to-date animal data coming slightly later in these slides, so this is just trying to set the scene. And look, this is great, isn't it? You know, right across the piece here, whether it's in people or whether it's in animals, we have got the overall tonnage of antimicrobials down, and down quite significantly. I think, you know, we've got a really good story to tell in the veterinary sector. If I just have a look at what we've done in animals compared to what's been done in humans over that time period, we had a 40% reduction in the tonnage of antimicrobials that we were using versus a 9% reduction in the human sector. And actually, if we look at those high priority, critically important antimicrobials, they had dropped by 2017 by 51%, and are actually down now to less than half of 1% of all the antimicrobials used in the veterinary sector in the UK. At the same time as a modest rise in the human sector. And I'm not putting that up to sort of brag about how brilliant vets in the agricultural sector are. I put it up because I want to try and draw out what I think are some of the differences, and I think these have already been alluded to in the presentations that we've talked about so far tonight. And I think the first one is that within the veterinary sector, we had a long way to go. We were starting from quite a low base when it came to thinking about some of that prophylactic and metaphylactic use. And I really well remember the first time I stood in a shed full of coughing calves with a farmer, looking at what was to be that farmer's profit margin for that year, really, this shed of calves, and said to him, I don't think we should give them antibiotics. That was a really scary moment as to what was going to be the outcome of this. Was I still going to be his vet tomorrow? Was I going to have a shed full of dead calves tomorrow? Were we going to make him go out of business tomorrow? So, you know, there's always that challenge, isn't there, between the longer term and broader goals of antimicrobial stewardship and recognizing the challenge that is in front of you. I'd say it had a brilliant outcome in that case, using a combination of non-steroidals and live vaccine through that group of calves. And I think, you know, we might have used half a bottle of Oxytet across the whole group of them. You know, it was fantastic what we were able to do by helping that farmer to keep that simple viral infection as a simple viral infection and avoid it getting to the stage of being a secondary bacterial infection, usually Mannheimia, in those calves that we're seeing. So, you know, there is a difference there, isn't there? You know, I've got 3 kids at school, and never once has a doctor walked into their classroom and said that one in the corner's coughing, so we should all give them antibiotics. So I can see, you know, we had a different start point with that one to the medics. But I think the place that we perhaps have more similarity is what I've called the pest of power. We've heard about it earlier today as well. You know, I always get antibiotics for this. That's what makes it better. That's what's going to make me feel better. And the equivalent to us there would be that very valuable beast who's gone down with something which may or may not respond to antibiotics. But the farmer's not going to forget if you didn't give it antibiotics and it dies. So I think, you know, it's been a slow journey, a slow progression to get to where we are today that has had to take all of those sectors with us. And I will come on to that very shortly, because I think that's a real big good news story that we can tell from the UK. And I think the other difference, of course, is in how we can manage those populations of animals. So here we are, look, here's me, you know, having a look at a cow through a feed fence. I finished doing that. I scrubbed down my wellies and you know, cleanse and disinfect using something which is you know, an approved disinfectant for that area, for that region, whatever. And then I go on and I see another field full of cows. Right, no problem. We're not taking disease from one to the other. And I think, you know, we mentioned COVID a few times today, but we tried this let's keep populations entirely separate message early in 2020, didn't we? With stay home, protect the NHS and save lives. And we know that that was a hugely powerful message and hugely advantageous to biosecurity. And we use that veterinary term kind of deliberately, really beneficial to biosecurity in the human population. But it was completely unsustainable. And it's probably equally unsustainable in farm animal medicine as well, isn't it? To think that these groups of cows are never going to mix. And so we evolved on, didn't we, to say, well, if we do these things, if we do happens face-to-face, then we're into the game now of risk reduction. We're not eliminating the risk of putting these people or animals together, but we're into the game of risk reduction. And I think what's really interesting, but not a topic for tonight, is what happens in human populations when you say, do you know what, we've moved into risk reduction, we're going to give you a lot more say over how you respond to that. This is a picture from London Underground. You must wear a face covering on public transport. I didn't have the courage, I'm afraid, to take a photo actually on the tube, where I suspect there was probably about 5% face coverings. And that's perhaps somewhere that I can control my populations a little bit more, isn't it? They're fixed on a farm, and I can control to an extent when they come and go and what happens to them in the interim. So I said I would come on to some of the more specific animal data, and here we are. This is a report which was just launched last week, and in fact we've just been delivering the kind of webinars to talk about this today. So this is a report which has now been going on for a number of years in the UK, looking at veterinary antibiotic resistance and sales surveillance report, the VARS report. And I'm really excited to hear that Ireland now has this sort of good system that's going to record sales data of antibiotics, because I think that this VARS report has been absolutely crucial to the buy-in that we've seen from industry and from the profession in terms of setting antimicrobial usage targets, and also thinking about how we're going to change management structures to get us there. In the UK, we're just beginning to come online with the eMedicines Hub, and having that as a central database, a central repository of all animal antibiotic and other medicine usage through their life, so that as animals travel between holdings, we can potentially, for the first time, have the capacity for their medicines history to travel with them. So what does this report show us? It shows us this. It says that, look, since 2014, we're now down to less than half of the mg per kg use of antimicrobials in our farm species than what we were in 2014. But you can see we've hit a bit of a plateau. We've hit a bit of a baseline where we're just grumbling around that 30 odd milligrams per kilogram. So I think we've taken the slack out of the system. And I mentioned my pen of calves earlier. Another example I would give you as to where we've taken this slack out would be in dry cow therapy. And I can feel the medics in the audience are going to cringe at this one. So I really am sorry, but this is where we've come from. When I was at college, I graduated in 2002. When I was at college, contagious mastitis that would spread from cow to cow, was a really significant part of the mastitis problem in the United Kingdom. And so dry cow therapy using intramammary antimicrobials for every quarter, so each of the 4 teats of the cow at the end of every lactation, was de rigueur. That's what we were expected to do. That was best practice. What we learned over the intervening sort of 19, 20 years is that actually not only were we wasting a lot of antimicrobials because we were putting them into udders that were completely uninfected, but that actually we were reducing the normal flora in those udders as well, and making it more likely for those animals to contract mastitis early in the next lactation. So we've evolved to what we now call selective dry cow therapy, where an individual risk assessment is made on each quarter of each animal before they're dried off, and only those that are deemed to be at high risk of being infected at that time are given the antimicrobials. The others are sealed with teat sealant. So we've had that slack out of the system, and we need to think about how we're going to make those next steps to bring us down to what we consider to be sustainable levels of antimicrobials across all of our production sectors. But I think equally important is to say, what classes of drugs are we using? We've heard a number of these mentioned before, and I really like that key analogy where, only the blade within all of those tetracyclines or those beta-lactams is different. So we can consider them just as big groups like this. But I would like us to point to the fact that, we are down now to less, as I say, than 0.5% of what we are using in our farm species being those high priority critically important antimicrobials. I mentioned that we are also seeing changes in our companion animal sector, our pet sector, and here we are. Here's the graph of their usage since 2014. Now, it's not such a dramatic reduction as we've seen in the farm animal sector, but it is only very recently that we've begun to see real concerted efforts being made in this field. And the challenges are different. I don't know how many people on this audience have ever tried to give tablets to a cat, but you know, there's some great videos on the internet about how many fingers you can lose doing so. And this is, I think, part of what's been driving this use of high levels of antibiotics, is that in order to get compliance with a course, we've been using things like long-acting cephalosporins, which we can inject once, and now we've given a fortnight's course to a cat. So we've got some real differences, I think, when it comes to the small animal field. The other thing, which again has evolved in the time that I've been a vet, has been the idea of prophylactic antimicrobials at the point of surgery in these animals. We all know that dogs' mouths, cats' mouths are absolutely filthy. We don't want them licking wounds, so we give them a couple of doses of long-acting penicillin at and around surgery and feel like we've done a good thing at reducing wound infections. But we like to think we're an evidence-driven profession, and we've recognised that the evidence does not support that. And I think it's the drop-off in those which is beginning to see this reduction in active ingredients that are being used. British Veterinary Association's own report, just released today, shows that in our Voice of the Veterinary Profession survey in the UK, 9 out of 10 of our small animal colleagues are worried about their ability to treat infections in the face of the global threat of antimicrobial resistance. There's another really nice bit of news in this VARS report this year, and this is the first time that we've been able to show this. And I'm not going to pretend for a moment that this means that we've kind of broken it, that we've done it. But if this trend continues, I'm going to be really excited, because this is looking at resistance to non-HPCIAs and HPCIAs of E. coli isolates from chickens. Now, look, you know, this isn't huge numbers. This isn't saying that E. coli is going back to being resistant to all antibiotics. But look, for the first time, we've seen a reduction in the resistant isolates isolated from chickens against all the classes of antibiotics that we've been looking at. And significantly, I think we've seen those reductions in those HPCIAs as well. And the reason they're drawn out in a separate graph look is because those numbers are so much smaller anyway. So I heard what was said earlier about the E. coli infections and about those multi-drug resistant E. coli infections. And I hope that this acts as a little bit of a beacon, really, to say maybe there is a little bit of hope on the horizon as well. So I said I'd come back to what I think is the absolute jewel in the crown of this in the UK at the moment, which is RUMA, the Responsible Use of Medicines in Agriculture Alliance. And I think RUMA is unique worldwide. In that, following on in spring 2016 from Lord Jim O'Neill's Antimicrobial Resistance Review, we came together as a profession with all of our interested industries and said, let's work on this together. Let's build a voluntary and collaborative approach and see what can we do together. What can we do together? And so Targets Task Force was born in 2016 and came to its reporting phase 2019 into 2020. And so, you know, we sat down, we had a really big committee meeting. We said, what should we do now? Targets Task Force has finished. And somebody came up with a really great idea of having Targets Task Force 2. And so that was launched. And Targets Task Force 2 has now been running for a year and is beginning to look at those other ways. As I say, we've had the low-hanging fruit. We've got rid of a lot of the prophylaxis. We've got rid of a lot of that unnecessary individual treatment as well. And so we're now beginning to look much closer at endemic diseases on farms, at management on farms, at what the role of nutrition on farms and how those can drive us further towards these sustainable levels of antimicrobial usage. And I think the other thing that we sort of recognise within that is that we are in a different environment now in the UK. You know, outside of the European Union, we need to think really carefully about where we go with antimicrobial usage and antimicrobial legislation to make sure that, that our farmers are able to continue to compete appropriately on a world stage when it comes to exporting the products that we produce as well. And we know that both European-wide and in the UK, we're expecting medicines legislation review towards the end of this year. And we do consider that those definitions of prophylaxis and metaphylaxis are likely to change again, with some restrictions being brought to bear on both of them. My final slide is just to say, look, where are we going next? And this is a really busy slide, and I don't want you to get kind of bogged down in the detail of it, but I just wanted to use it to highlight where we are with Farm Vet Champions, because I do think that this is really an exciting initiative within the UK at the moment. And what I would see this as is creating farm vet champions within all general practitioner farm vet practices who are likely to have contact with mixed farms. And we're primarily targeting this towards our ruminant sector, but we're also bringing in some of the white meat sector as well, and potentially some of the smallholders as well as that. And the idea is to recruit, to train, and to encourage a UK-wide network of farm vet champions to set, meet, and record both personal and practice level specific medicine prescribing goals. And we set some of those in place at Cattle Veterinary Association Congress in October. Individual vets being given that responsibility, that ownership of signing up to become a farm vet champion, operating either at an individual or at a practice level. We putting no restriction on the number of people who can sign up, but what we're looking for is to try and get 2,400 of the estimated 6,000 farm vets in the UK signed up to this programme over the next few years. And I think what we're aiming to do with this is to continue to build veterinary capacity and capability through education, online learning, being able to track people's progress, and also to evolve that culture on farm to secure both veterinary and farmer buy-in through that training and that behaviour change, to implement those antibiotic stewardship campaigns across the range of livestock species at that point of interaction between practicing vets and their farm clients. This is led by RCVS Knowledge, Royal College of Veterinary Surgeons Knowledge. It's a charitable partner of the Royal College of Veterinary Surgeons, and British Veterinary Association have been absolutely at the hub of developing this as well. I've mentioned that we're going to look through what happens with the medicines legislation review, and we're going to think about how we can ensure that the UK is not duplicating legislation whilst considering emerging drug threats. We've heard at the Rumour conference today some really exciting research on how we can begin to extrapolate from medicines residues in one tissue of one species to what we might anticipate that being in different tissues or in different species, and beginning to think about how we can use that knowledge to better enable us to use a broader range of more appropriate drugs, perhaps within within future legislation. But part of that is about thinking, how do we reserve the drugs that we know we need to reserve for the times that we really know they're the only thing that we need. So as a profession, we're absolutely alongside the whole idea of continuing to set those targets, continuing to drive towards a genuinely sustainable antibiotic use. And we're doing that under that umbrella of environmental, human and animal health, our one world health. And I can't think of a hopefully a better place for my presentation to come to an end than thinking about that long-term future for all of us. So thank you for the opportunity to present this.
Thank you very much, James. It's always really interesting to hear what's going on in our near neighbours, and I think your presentation highlighted a lot of similarities in terms of our approach, particularly around the selective dry cow therapy. We've also seen significant reductions in use and resistance in the sector here too. And just to say, the Farm Vet Champion, we're very interested in that, and we have a speaker, you'll know her, Fiona Lovett is speaking at one of our webinars next week, so we will certainly be looking at that further. So thanks a million, James.